Hello and welcome to part 1 of an introduction to menopause. This 7-part series is to learn about why the menopause occurs, the physical symptoms, the use of HRT, and a look at how to help with the main symptoms of the menopause, areas such as sleep deprivation, mind issues, reduced libido. I also wish to discuss alternatives to HRT and the support that is available in the workplace and how to access this. A definition of the menopause is when a woman stops having periods and is no longer able to get pregnant naturally. The World Health Organization states natural menopause is defined as a permanent cessation of the periods resulting from the loss of ovarian follicular activity. Because females are born with a fixed number of follicles, this is the ovarian reserve, and this dictates an individual's reproductive lifespan. However, there can be other ways of menopause occurring. There is a surgical menopause when the ovaries have been removed, or planned suppression of the ovaries with drugs to stop estrogen in cases such as breast cancer. Or the ovaries could be damaged with radiotherapy. Facts about the menopause. The menopause is a natural part of ageing, and this is when the estrogen levels decline. It does occur more commonly between the ages of 45 and 55. However, 1 in 100 women will experience the menopause before the age of 40. It is diagnosed as premature menopause if your periods stop before the age of 40, and early menopause if they stop between the ages of 40 and 45. If you have a premature menopause, you should be on HRT until the age of 50, unless you are not allowed HRT in cases such as a history of breast cancer or a deep vein thrombosis. The following diagram shows how the hormone blood levels change as the menopause progresses. The top diagram gives a clear picture of a regular monthly cycle over a 6-month period. You can see clearly how the estrogen and progesterone levels are high, working in combination with the follicle stimulating hormone and luteinizing hormone to start the process each month of growing the endometrium, which is the period layer, in preparation for an egg to implant. Then mid-cycle, an egg is released. At the end of each month, if a woman is not pregnant, you can see how all the hormones drop and the endometrium or period layer is shed, and the process begins again. The middle diagram is the perimenopause period, and this shows quite clearly the fluctuation of hormones that vary over a 6-month period. This is why it is often not useful for the GPs to do a blood test to check if you are in the perimenopause or postmenopause, because it is impossible to time it. If your levels are checked and you have normal blood levels at that point but are symptomatic and feel very unwell with your symptoms, the doctor may not want you to have anything. So it is better to just take a history and, through a process of elimination, work out if the probability is menopause, and if you request HRT, you can trial this for 3 months. The third diagram shows how the hormones flatten out in the post-menopause phase. And as you can see, the estrogen and progesterone levels have gone very low. So what's going on? The hormonal changes and cause the imbalance because of the estrogen production decreasing, neurotransmitters production decreases, which regulate the mood. Thank you for listening. please see the useful web contacts for further information and support.